Hey everybody, welcome to the Open Our Healthcare Town Hall live with Senator Bernie Sanders from Washington, D.C. Senator has been great.
From Vermont. I work in Washington, D.C.
From Vermont and also Michigan simultaneously. We've been doing these town hall tours all over the state of Michigan. We've done 4 already, everywhere from the Upper Peninsula down to the city of Detroit, Pontiac, and we've had great conversations about healthcare and the need for Medicare for all. Senator, you've been fighting the good fight on Capitol Hill. Can you give us a sense of what we're walking into when it comes to the healthcare calamity that people are facing in this country?
Well, and by the way, one of the reasons I have endorsed this guy is there are no people in the Democratic caucus who are physicians. Ironically, the Republicans have 4.
Yeah. And look where they got us.
Yeah, and they're all quite conservative guys. So we need somebody who knows the system, and Abdul, in fact, wrote a book with the title of
Medicare for All, A Citizen's Guide.
There you go. So he knows the issue, he knows the system, and in my view, the crisis in healthcare is one of the most important issues that has to be dealt with. So you ask me what's going on. I will tell you, Abdul, I have been all over this country. And invariably, I would ask people, you tell me whether the healthcare system is working or whether it's broken. And almost unanimously, people understand that the healthcare system is broken, it's dysfunctional, it is cruel, it is wildly expensive. And you know better than I do that we are now spending, you know what we're spending now? We're close to $15,000. Got that, folks? $15,000 for every man, woman, and child. That's roughly twice as much as any other major country on earth.
That's right.
And what are we getting for this $15,000? Well, we got 85 million people who are uninsured or underinsured, including some of you, which means you don't go to a doctor when you should, which means that tens of thousands of people in our country die unnecessarily because they don't get diagnosed when they should. It means that our life expectancy is 4 years lower than OECD countries, and if you're working class, it's a lot lower than that. It means that in America, we pay by far the highest prices in the world for prescription drugs. It means that we don't have enough doctors or nurses or psychologists or pharmacists or dentists, despite all of the money that we're spending. Now, that's the bad news. Here's the good news. The drug companies and the insurance companies are doing just great. They are making tens of billions of dollars. They're paying their CEOs outrageous compensation packages, and that's the function of the current healthcare system.
Right.
So it's working. System is working for the drug companies and the insurance companies, but for you, I'm afraid not so much. And, as everybody should know, as a result of Trump's big, beautiful bill, our situation is going to get a lot worse. It's unbelievable. 85 million uninsured, with Trump throwing 15 million people off of Medicaid, raised that number to 100 million, and as a result of not continuing the ACA tax credits, premiums for people on the Affordable Care Act will on average double, in some cases triple or quadruple. So you add it all together, the system is a total, absolute disaster. And one of the reasons I strongly support Abdul is he understands that, and he's going to help me fight for Medicare for all.
That is absolutely right, Senator. And I want to explain to folks and share with folks why Medicare for all solves all the problems that you just outlined, and why it is it's a single solution with a number of different facets. Think about it as like a Swiss Army knife to fix our healthcare. And just to explain why, I want to share a little bit about how the current system works. Senator, I happen to know that in Vermont, you guys have some lovely farmers markets.
Okay? We do.
And if you were to go to a farmer's market and it's the fall, so let's say you're shopping for like acorn squash, okay? And you want to buy acorn squash. What'll happen is you go find an artisan who's selling acorn squash. You ask them how much it costs, and then you tender the price for the acorn squash. You get acorn squash, you gave the artisan some money who grew the acorn squash. That's how you be a customer, right? They want to tell us that we're a customer in the healthcare system, but we're actually not. And to explain why, I want you to hold that customer experience in your mind as I share what it may be like if I started to clutch my chest, right? If I started to clutch my chest, hopefully somebody in this room would call 911, right? And you would take me to not the hospital of my choice. You would take me to whichever hospital was closest, where I would see a physician not the physician of my choice, whoever physician was on call. And then they would do some procedure, not the procedure of my choice, but the procedure that they deemed to be necessary. And hopefully after that, I will have had my life saved. But I want you to then think about the financial transaction that happens from there. I happen to be insured through, I hate to say it, United Healthcare, okay? And what would happen is the hospital would send a bill to United Healthcare, and then United Healthcare would send me the remainder. Since I haven't paid my deductible this year, I would be hit with that 1,000 or whatever X thousand deductible that I have to pay. But I want you to think about what just happened. I was the reason why a financial transaction happened between a provider, a hospital system, and my insurer. So in that analogy, think about this. Am I the customer,
Right.
or am I the acorn squash? Right? I'm the reason a financial transaction happened between two other entities. And that right there is a big reason why our system is so broken. But then I want to go a little step further. Those prices that were negotiated weren't negotiated in open. They're not the same prices for everyone. It really depends on what they call a trade secret between my hospital provider and my insurer. And those trade secrets are built with both of those entities in mind. The health insurance companies are all interested in negotiating with the ability for them to.
And what that means is that if I have a different insurance company than you do, and I also have chest pains and also go through the same procedures, I can be paying significantly less or more than you're paying.
Exactly right. Exactly right. And these negotiations are a system that allow each of these folks to try and outcompete their competitors. And that's what happens when we leave both health care provision and health insurance for profit.
Right.
And all of that has meant that, I don't know about Vermont, but I'll tell you in Michigan, we've seen hospitals buying each other up. Because the bigger they get, the better the reimbursements that they can negotiate with the insurance companies. And when they do that, they're doing that so that they can outcompete the smaller hospitals, ultimately buying them up. And if they're not making enough money, selling them for real estate.
Well, I mean, the bottom line, I think, of all of this is, are we comfortable with very large corporations, giant corporations, insurance companies, drug companies, running our healthcare system for clearly the goal of making money? I'll give you a simpler example. The goal of good healthcare is to try to keep people healthy, right?
That's right.
Obviously, we want to ease suffering, and you know what? When people are healthy, they don't end up in the emergency room. They don't end up in a hospital for hundreds of thousands of dollars of care. We spend in this system half as much as other countries spend on primary health care.
That's right.
So the truth is that even in America, in Michigan, certainly in Vermont, I can tell you, even if you have decent insurance, I have decent insurance, very expensive, decent insurance, it takes you a long time to get into a doctor's office when you need to.
You know, Senator, you know what the average wait time for a cardiologist is in America?
How much?
2.5 months.
That's pretty crazy, isn't it?
Because nobody ever tells you to
I
see a
got a pain in my chest and it takes me 2 months to get in.
Yeah, if you want to see your outpatient cardiologist, if you have a pain in your chest right now, they'll see you in the emergency room.
Right.
But to get a follow-up with your cardiologist, that might take you months. And they tell us that we should be so afraid of wait times, when the wait times that we wait in this country are exceedingly high as it is.
Right.
It is Stockholm syndrome. Except for in Stockholm, you get better healthcare than you would in the United States. When it comes to healthcare, you might actually want to have Stockholm syndrome. You get killer healthcare.
Look, I think there are a couple of very fundamental issues which have motivated me. And the simple one is healthcare a human right? Now, you want to buy a multi-million-dollar house? Fine, you got the money, you do it. You want to buy a fancy car? Fine, do it. But in terms of healthcare, should all people, low income, rich, young, old, get the healthcare they need when they need it? That's the simple question.
That's the simple question.
Or do we say, well, I'm sorry, you're working class, you have a $10,000 deductible, you're kind of sick, you can't afford that deductible, well, tough luck. That's the way it is. Or guess what? You had an emergency, heart attack, whatever. You ran up a, $100,000 bill in the hospital. You're working class, how are you going to pay that off? Well, you can't. You're going to go into bankruptcy. And as we know, and I know you dealt with this in Michigan a lot, you got, what is it, like 500,000 cases of bankruptcy a year are medically related, are they not?
That's
Something
right.
like that. So, look, running a healthcare system is not easy, all right? But if we start off with the goal of, number one, healthcare is a human right. We're going to cover every man, woman, and child because they are human beings. And number two, we're going to try to make it cost effective. If you start off with those goals rather than enriching the drug companies and the insurance companies, you go from there.
That's right. And the way Medicare for All works, right now we have a bunch of health insurance companies, all private. Medicare for All says we have one insurer. That is the baseline for everybody. It insures you the moment you are born, the moment you turn 26, you get married, hopefully don't get divorced, but that too, get a job, hopefully don't lose a job, but that too, turn 65. It's there for you.
Stay on this point, because it's a very important point. Right now, we have a completely confusing, complicated hodgepodge
system.
System. All right. What we saw during COVID, and what you see every day, what happened during COVID? Millions of people lost their jobs.
That's right.
Their health care, their insurance was attached to their jobs. You lose your job, you lose your health insurance. This is why we greatly expanded Medicaid. But right now, Abdul, it's interesting, it's not talked about too much. I will bet that there are millions of people who are on their jobs right now, not because they like their jobs, not because they want to stay on their jobs, but because they may have decent health care. Maybe their wife, their husband has some chronic illness that this insurance program will cover. Think about how crazy that is.
Crazy.
So when you have universal care for everybody, you know what? You're not tied to your job because of insurance.
Yeah. You know, there's a question we got from a woman named Amy Crane. She said, what would the financial impact of universal health care be to the average working American?
Okay.
And you talk about that extremely well, but you know, all these folks out there, when we talk about Medicare for All, they say, oh, well, that is against the market system. Why are you against markets? And I want us to think about how many people with a great idea who could go out and start a business if they weren't choked out by the fact that they're stuck in healthcare because their kid might have asthma or their wife might have had cancer, are stuck in that dead-end job and are not starting new businesses.
Just think about the irrationality and the unfairness of an employer-based healthcare system. You work at McDonald's? All right, I work
at Kroger.
Okay, I work on Wall Street. I have a good health insurance program. You, if you're lucky enough to afford it, have a bad one. I was just talking to somebody recently. The company that this woman's father works for gives him 39 hours a week. Sound like a funny number, 39 hours a week? Okay, yeah, because to keep him from getting the health care. Many fast food places will give you health care, but it's so expensive that the workers can't even afford it. So the first basic question is, should health care be a human right? Should it be universal? And it should be. And the advantage of Medicare for All, as Abdul was talking about, is we end this enormously complicated system, which is driving everybody crazy.
Yeah.
All right? How many people spend endless amounts of time on the phone arguing with their insurance companies, demanding to get the coverage that they believed they paid for, right?
Yeah. Senator, I'll tell you a story. I was on the campaign trail, and this woman stayed behind after all the questions had been asked. And she said, I'm a nurse, and I want to tell you why. I said, why is that? She said, well, I care for breast cancer patients, but I used to work for the health insurance company. And I was forced to deny a woman with terminal breast cancer her care. And I knew that this would put her into bankruptcy. But there was a justification to do it, and the health insurance company made me do it. And guess how much the CEO made that year? $18 million. Yeah. She said, I put a woman who was on death's door into bankruptcy. And I made the pain that she had to feel so much worse for her and her family because of the greed of an insurance company. So I quit then and there. I went to nursing school, and now I take care of people with breast cancer.
Good for her.
Right.
But the truth is, I mean, when we talk about a cruel system, and not only wildly expensive and bureaucratic and dysfunctional, think about that. I mean, just, it is so insane. Look, somebody gets a diagnosis of cancer. That's a traumatic moment in their lives, right? That's right. Oh my God, what's going to happen? What kind of treatment do I have to go through? Fortunately, a lot of treatments now are better than they were 20, 30 years ago. People have a shot at living, but it is an expensive proposition. So what's the first thing people are going to be thinking of? Oh my God, how do I afford it? And the answer is that a very significant percentage of people who are diagnosed with cancer either go bankrupt or they deplete their life savings.
68%. So imagine that, 2/3.
Just throw that out. You want to know why we support Medicare for all? Think about the insanity. When you get diagnosed with cancer or some other terrible disease, you're struggling for your life. Is the last thing you need to worry about is the financial implications of what your disease will do. You got to worry about getting well.
And Senator, you mentioned this earlier, but think about the fact that the medical debt in this country is $225 billion. That is more than the GDP of half of all states in this country, just in medical debt.
Right.
And the idea that, I live across, both of us live across from Canada. I went over to Canada and I asked folks, tell me about what you do with your medical debt. And the look on their face was just like,
I know what you're talking about.
it's like an insane thing. And we take it for granted that this is a thing that can happen to you if you get sick, that you go into debt.
All right, so the main point, and the main point to be made here is when people say Medicare for all is radical, it's a far left idea. Understand that what is radical is we are the only major country on earth not to guarantee health care for all. The only country where people know what the word medical debt is or bankruptcy is, because other countries don't have it.
That's right.
Yeah, in Canada, you're in the hospital for 2 months with a transplant, a serious issue. You come out, you know what your bill is? $0. Well, I get their parking lots there that are pretty expensive. So.
It's because you parked your car for 2 months. I'll tell you. So I had a question. There was a question from Deb, and I think it's an important one for both of us to touch on. She talked about choice and gatekeeping.
Good.
And one of the arguments that a lot of the opponents, or we'll just say the apologists for the health insurance industry will say, is that, well, what about your choice? And they make us think that the choice that we want is the choice that a lot of people are making right now between some high premium, low deductible plan or some low premium, high deductible plan. But you think about who the biggest gatekeepers in healthcare are. It's the networks that are created by these insurance companies because they want to have sweetheart deals with the hospitals that are consolidating in the system. And imagine a world where your insurance gets taken everywhere because it is the national insurance. And how many more options what you actually might have.
But you see, that is not hard to imagine. You got a card. Golly gee, this card works any place in America, right?
Right.
What is hard to imagine is you have a card from Michigan and you have a heart attack in Florida. Oh, gee, you're out of the network there, Abdul. I am sorry about that. And that's insane. So, and the other point is, you talk about my conservative friends worry about cost effectiveness. Well, there is a reason why the current system costs us twice as much per capita as any other country on earth. And that is the waste in it is enormous. Go to any hospital, go to the basement probably in the hospital, and you're going to see dozens of people. You know what they're doing? They're not treating patients. They're not making medical diagnoses. They are billing you.
That's right.
So we spend a huge amount of money on billing. They spend it on advertising. They spend it on this, that, and the other thing. And what was interesting is a number of years ago, the Congressional Budget Office is a nonprofit entity which figures out money things, determined that Medicare for All would save hundreds of billions of dollars a year, eliminating all of that bureaucracy. And so when we spend $1 for healthcare, what do we want? We want to go to a doctor, to a nurse, to prescription drugs. We want it to improve people's lives, not to make money for the insurance companies, not for stock buybacks, not for some guy on the phone driving you crazy because you owe. I mean, I've done a lot of town meetings all over the country, and some of the most painful. My God, I remember when I was in Iowa, I think, and this woman's kid was just terribly ill in the operating room, literally, and she was getting calls from the insurance company about how she was going to pay for it and all this stuff. I mean, and not only is that outrageous, it's expensive. Somebody is paying that guy to hound you for your medical bills.
And there's a couple of things here. Our conservative friends like to talk about waste, fraud, and abuse.
Right.
And they don't think it's wasteful or fraudulent when some CEO is making $18 million, every single dollar of which came out of your pocket to buy them a yacht. You're talking about waste, fraud, and abuse.
Right.
We have that built into the system, but because somebody's making money, we think that that's perfectly okay. Right. And it means that you are limited in the choices that you actually want. And it means that you're paying exorbitant amounts of money. And I just want to explain why Medicare for All would be so much less expensive. when you have one insurer that is the insurance for everybody,
Right.
all of those armies of billers go away because everybody's billing the same single
Right,
program.
right.
The other part of it is they are what's called a monopsony. A monopsony is like a monopoly, but instead of one seller of a good, it's one buyer of a good. So they're buying healthcare for all of us. And when there's one buyer, you get to dictate the price. So you get to drop down the price, because the thing that we also talk about, we talk about how expensive the healthcare program system is, but we don't talk about the fact that it's also growing in price faster than any of our other system. So it's not just the most expensive today, it is going to be more expensive tomorrow by more than any other system in the country and in the world. And Medicare for All solves that, because now all of a sudden you have some pressure back down the system to stop raising costs. And I want to tell you this. It was an interesting thing. Have you noticed that when you walk into a private hospital, the atrium is beautiful and there's someone playing the piano? Does that actually improve your healthcare?
Not usually.
No. And the reason they do that is because they are in a competition for patients. And because they're in a competition for patients, the only way you can indicate that you have a quality service is by building a nice atrium and having a piano in the front. But it doesn't mean that the surgeon in the back is any better.
Right.
If anything, it means that they took money to buy a pianist rather than a doctor. Right? And our system does that because we think that for-profit is better. And in our system, it's just one more example of, again, waste and abuse, right? But we think that somehow this should be a normal thing, rather than actually investing in the thing that we want, which is better health and health care when we get sick.
And I think most people instinctively, they don't write books like you do, and they don't know all of the details, but they know that the system is broken. They know how painful it is that families have to make choices as to whether or not literally they're going to have health insurance, or whether they're going to use their deductible or pay for something else that they desperately need. But what we're up against here is an incredibly powerful corporate system that wants to maintain the profiteering that exists under the current system. And when you talk about why we pay, I left from Michigan. I was running for president. I think it was from Michigan to Canada to buy insulin. It was at the time. We got it there for 1/10. It took us about an hour to get into Canada. It was 1/10 the price.
Yeah.
And drug companies here make a fortune. Why is that? Because now we made some improvements under Biden.
You did.
We passed some. It's a good start, but we've got to go a lot further. But I want everybody to be asking, why is it that we pay on average about twice as much per capita for healthcare as the people of the countries? And the answer is, as you just indicated, every other country negotiates.
Yes.
You got a national health program, sit down, let's talk about what you're going to charge us. In America, hey, charge us anything you want. It is perfectly okay.
And the crazy thing is, Senator, we paid for all the research and development.
That's right.
All the early stage research. The NIH paid for that early stage research. That is our taxpayer dollars that went into originating those medications that we end up paying more for on the back end because of our ridiculous public policy that doesn't allow us to negotiate. And I think we made, like you said, some really important strides. But the idea that we don't negotiate on every prescription drug for every single patient is ridiculous.
And I want people to know, I mean, on average, it's about double. In some cases, it is literally 10 times more. And the result of that, and as a physician, I'm sure you're aware of that, is something like 1 out of 4 Americans cannot afford the prescriptions their doctors write. Now, think about how insane that is. You go to the doctor says, okay, this is your problem, this is what you need. Duh, I can't afford to fill it, so what happens? I get sicker.
And doctors know this. There are many doctors that I talk to every day, colleagues of mine, who say, I know that in treating this patient's ailment, I am potentially putting them in bankruptcy. Imagine that. And so you're sitting there trying to figure out how to negotiate their finances when you're really just trying to take care of their health.
All right. So I want to get back to people say, well, all right, if all of that is true, if most of them are, just the poll that came out a month ago, I think, well over 60% of the American people support Medicare for all. A lot of Republicans, Democrats, Independents. Why haven't we passed them? Why do we only have in the Senate now 18 co-sponsors out of 100 members? In the House, I think we got about 100 out of 435. Why is that? And the answer is a corrupt campaign finance system.
Yep.
The answer is that these large corporations, both in the insurance industry and the drug industry, pour a whole lot of money into campaign contributions. The answer is that they put money into super PACs, that they have enormous number of lobbyists. Last I heard, the drug companies have 1,800 lobbyists in Washington, D.C. for 535 House and Senate members. It is insane. 3 lobbyists for every member.
So, Senator, how much spending is going to come against me because of my position on Medicare for All?
Oh, I am sure a whole lot. A whole lot.
You know, I'm the only person in my race who doesn't take corporate money, and I'm the only person running on Medicare for All. Those two things are not coincidental. But this is the thing about it, is that the movement is winning. There was a recent poll that just came out, showed that Medicare for All is now more popular than it's almost ever been. We just got a critical colleague of yours who's a leader in the Senate, Chris Van Hollen, who just signed on.
We got 2, Tina Smith.
Tina Smith.
Tina Smith, so, yeah.
And so folks are recognizing. And so the thing that you're really speaking to here is that if we want Medicare for All, we have to first believe that it is possible. Don't let anybody tell you it's not a serious idea. It's funny, like the number of people who are like, oh, that's not serious. I'm like, I went to whole medical school, did a PhD in public health, wrote a whole book, published by Oxford University President, and you're going to tell me it's not a serious idea? Like, you are not a serious person if you don't think it's a serious idea. Right. The question is, are we willing to get behind a politics where we fight together for what we need and deserve? And that's what you did in your presidential campaigns. It's what you've done as a senator from Vermont. It's what we're trying to do in our campaign in Michigan. And the only way that we can win this fight is by organizing together, getting past the differences they tell us that we can't breach. I go up north and people tell me, well, the reason we don't have is because people down south. And the people down south tell me the reason we don't have is because of people up north. And I'm like, the reason none of you have is because of people in D.C., right? And we have an opportunity to come together around that. And I'm hoping that our campaign, that the work that you're doing can be a place where people go to get involved in the fight. In our case, obviously, I hope folks will go to abdulforsenate.com and sign up, volunteer with us, chip us off $5, $10 if you can. But more importantly, be an ambassador for this idea in your own community, right? Most of us just got back from Thanksgiving, probably had some unfortunate conversations, but hopefully had some hopeful ones. And we're going to be back together in the holidays. Be an ambassador to work with folks in your community to say, we actually can't have nice things if we're willing to build them together.
Look, I mean, I happen to believe, not just me personally, I think, but of all the issues that motivate me, there are so many out there. Healthcare is the one. Because it touches every person, right? You're thinking about having a baby.
Probably born in a hospital, probably going to die in a hospital.
Just, you know what it is? Well, you know this stuff better than I do. Having a baby today is what, $20,000 or something or more? Nursing homes are now understaffed. We treat the elderly and disabled in shameful ways in many respects.
Staffing ratios are not safe because of the hospital's incentives.
Right. So I think what all of this is about, and it's not just healthcare, it's housing, it's education, it is taking a hard look at where we are as a nation. We are the richest nation in the history of the world. You would think that we would have by far the best healthcare system in the world. All over the world, people say, my God, what a great healthcare system you have. Study after study, international study shows that we have one of the worst. Yeah. So it's not only that it is wildly expensive, our infant mortality rate is much too high, our life expectancy is too low. We do not do particularly well in a number of diseases in terms of outcomes. So to get back to the point that you made, we have to have a different vision of where this country can go. When you're the richest country in the history of the world, of course, without going without saying, you're going to have a great healthcare system guaranteeing healthcare to all people. Of course, you're going to have a great educational system open to all people. Of course, we're going to have affordable housing. But the dynamics of Washington, not only on healthcare, but on everything else, is we have an administration that got $1 trillion in tax breaks for the 1%. Anybody out there, raise your hand if you think Elon Musk and Jeff Bezos need a tax break. And in order to pay for that tax break, what did we do?
Cut Medicaid.
We cut through 15 million people off of Medicaid. And studies out there suggest, I mean, this is just unbelievable.
It's going to kill people.
Yeah, like 60,000.
Yeah, and it's going to shut down rural hospitals.
Exactly, and hurt nursing homes that are largely dependent on Medicaid. Who in their right mind believes that you give massive tax breaks to the 1% and make decisions which result in the deaths, unnecessary deaths, of tens of thousands of low-income and working-class people? Nobody believes that.
The other thing that kills me is when you start...
Don't use the word killing. We're talking about healthcare right now.
Well, unfortunately in America, that's kind of those two things go hand in hand. The thing that frustrates me to no end is that when it comes to most things, Americans believe in what our ability is. And when we stand up and we advocate that we could have the best, most complete healthcare system in the world, it's amazing to me how our conservative friends, our naysayer friends, our corporate friends will tell us, yeah, but like, look at that system over there. Look at Canada. I'm like, first of all, in Canada, they live 2 years longer than we do. They spend nearly half as much on healthcare than we do. And in survey after survey, they're happier than we are. So actually,
Right, exactly.
working pretty well. But
I mean, is it a perfect system?
no.
No.
But why couldn't we do it better than Canada?
Exactly.
There's no
We're
circumstance.
spending twice as much.
Exactly.
Look,
So
this
like,
is the point. If I have a car in which I'm spending $80,000 for my car, you're spending $40,000 for your car,
well, I'm from
and
Detroit, so
and your car is better than my car, something is wrong, right?
That's right.
You're right. We are spending far more than the Canadians. We can address the problems that they have. But the basic principle that they're operating on, healthcare is a human right, it is universal,
Right.
and administratively much simpler. And the other thing, we didn't get into, this system is not only expensive, people not only die and suffer unnecessarily, people go crazy trying to fill out all of the bloody forms that you got to fill out. I mean, they really do. And how much time? Forget all the doctors who have to argue with the insurance companies and the nurses who have to argue with the insurance companies. Think about the amount of time that people are spending on the phone arguing with the insurance
and they do it
companies.
for you on purpose. They do it on purpose.
Right, of course.
Now I'll tell you a crazy story. I got strep throat, easily treatable condition, over a holiday vacation, and I was in California. And I hadn't paid my deductible down that year, and I knew what I had, but I needed to get a prescription. So I went to an urgent care. I asked them, so do you take my insurance? They're like, sure. And so I billed my insurance. The crazy thing is, the cost with my insurance ended up being higher out of pocket than what I would have paid had I not billed my insurance. And then when I asked the insurance, they were like, well, you were out of network. Yeah. I was like, I was in LA. Like, what did you want me to do? Wait till I came to Michigan? And they were like, well,
You got strep throat in the wrong place.
You should have gotten strep throat. I'm like, I agree. I didn't want to get strep throat. That was not my goal. It ruined my vacation.
But I mean, this whole concept of what genius, I mean, all of these crazy things. If you go to other countries, go to Canada, say, network. They would not know what you're talking about.
That's right.
I remember I had a discussion with a young woman, a very well-known singer. We were doing a Zoom call. And I said, do you know what a deductible is? She said, deductible? No, never heard of it. I mean, these are concepts. I mean, just think about the insanity of a deductible. If you're working, and by the way, these deductibles are not $500. You talk, often when I do meetings, town meetings, I say, all right, tell me what your deductible is. $5,000, Bertie. $10,000. I got $12,000 deductible. So if you're a working class person, that means you're never going to use your insurance.
Yeah, it's like, what's the point of being insured?
Exactly.
At that point, like, you're going to go bankrupt anyway.
So, and who could afford $12,000 out of pocket, And again, I want to just reiterate that what Trump has done and his Republican friends is made a horrific situation. You would think that after all of these issues we're talking about, the goal is, okay, well, how do we go forward? How do we make sure that everybody has insurance, is covered? How do we lower the cost of healthcare? How do we make prescription drugs affordable? No, that wasn't their logic. Their logic is, how do we pay for $1 trillion in tax breaks for the 1%?
Right.
Oh, I got a brilliant idea. Let's throw 15 million people off of their healthcare on Medicaid. Let's double premiums if you're on the Affordable Care Act. I mean, you're really into crazy world. I mean, this is not, there's a lot to be argued about, but this one is a no-brainer. There's nobody in America, or very few people, that makes
Senator, you have
sense.
to truly believe that a person's value is their bank account and not their body to be able to justify that. And I worry that for a lot of people, they have so hook, line, and sinker swallowed the logic of corporatism that they actually believe that the value of tens of millions of dollars for people who have billions of dollars is worth more than the value of the life that someone has just because they have it. And that's the logic that drives this.
Abdul, you're touching on a very deep issue which worries me very much. And that is, you got teachers out there who spend their whole lives really impacting, great teachers impacting their kids, difficult job, and they're making $40,000, $50,000, $60,000 a year. And you got child care workers who are doing important work, making $15 an hour.
Literally, the people who we entrust with our most vulnerable people.
Right. Making McDonald's wages. And this worship of money, which is all of what Trump is about. I mean, that is the essence. There's a religion out there. It's called greed.
Yeah.
And if I can lie, cheat, and steal my way to billions of dollars, I'm a great success. But that family doctor who is there 7 days a week for my community, or that teacher who works her brains out trying to improve life for the little kids, they're suckers, they're pretty dumb.
Yeah.
Must be dumb. I mean, even in your profession, you will hear, and I talk to people in medical school, when people say, gee, I'd like to go into primary care. Oh, must not be very smart. You could become a surgeon or a specialist and make 2 or 3 times as much money, correct?
Yeah. You can imagine what they said about me when I went into public health. But that's the thing about it. It's like, I don't know what happened where we stopped valuing the value you add to other people.
All right, I want you to talk about, because I believe public health is enormously important. Tell the people, and I know you've been involved in Michigan, Detroit, talk a little bit about the work you've done.
Yeah, so I rebuilt Detroit's health department after it had been shut down when the city was pushed through bankruptcy by an austerity-driven governor. We did things like guarantee every child a free pair of glasses delivered at school within 2 weeks of a vision test.
So I would imagine there were a lot of kids who couldn't afford a pair of glasses.
So you can imagine, right? Literally 30% of our kids who would test positive for vision deficits would test positive again next year. Meaning we knew they needed glasses,
right?
And nobody got them a pair of glasses.
Which means they couldn't see the blackboard, they couldn't read properly.
We talk about funding schools, but it doesn't matter if you can't see what's happening on the blackboard.
Right, so you got kids' glasses.
That program's now done 50,000 pairs of glasses across the state of Michigan. We took on some of the biggest corporate polluters, right? We had an asthma rate, 3-fold the probability of asthma hospitalization in the city of Detroit. The biggest polluter and the most polluted zip code in the entire state wanted to raise their emissions of sulfur dioxide, despite the fact that the EPA had said there was already too much of it. And so we were able to organize with the local community. We forced them to invest $10 million of their own money to reduce their emissions when they wanted to increase them. Flint water crisis happened just north of us, about 50 miles. I was the health director for the city. We had every school, daycare, and Head Start tested for lead in the water. And Senator, you'll never believe, in the first 68 schools we tested, 19 of them tested positive for lead. So we got them on a pathway to being lead-free. I got to work with folks to rewrite the lead laws in the state. More recently, I've been serving in Wayne County, leading Health, Human, and Veteran Services for about 1.8 million of our residents. And we found that our county ranked to number 8 for medical debt nationwide, number 8. And the thing about medical debt...
All right, give me some examples. Give the viewers some examples. Give me an average case of medical debt.
So average case about $1,500, right? But this is somebody, I'll tell you a guy named Mr. Larry. He's a Detroit bus driver his whole career, right? And he was in a situation where he got hit with a medical debt, and the calls kept coming every single day.
People hounding him for the money.
Hounding him for the money. And this is a guy who's a retired bus driver, right? He's barely making ends meet. And when he got his relief letter saying that your medical debt has been erased, he said, this gave me a new lease on my finances. I thought I was going to die with this debt, right? And that's one example. It goes as high as $50,000. $50,000. And the thing about medical debt is, the minute it gets originated, the minute that a hospital has debt and somebody doesn't pay it, what the hospital will do will sell it to debt collectors. But those debt collectors will buy it for pennies on the dollar. So what we did is we just said, you know what, actually we can buy it for pennies on the dollar. So we worked with an organization called Undo Medical Debt, and we put forward $7 million to buy $700 million of medical debt for 300,000 people. It's our state's biggest medical debt erasure effort that's been taken under. But why can't we do this federally? And I know, right, one of the last times I was up here, we were in a conversation in the well of a committee room talking about medical debt erasure. So you think $225 billion, the price of paying this down would be about $2.5 billion.
And it would mean a tremendous relief, and just the stress level for people would go way, way down.
Yeah, and think about this. We sent $22 billion to a foreign military conducting a genocide to bomb other people's hospitals.
That's right.
And for $2 million, we could erase all the medical debt for the entire country.
Yeah.
And these are our values.
Well, I mean, it goes on and on and on. We give tax breaks to the rich. We're spending now $1 trillion, including continuing to spend money to the Netanyahu government to continue their genocide in Gaza. And it's not just that. It's, the lunacy of presidents selling F-35s to Saudi Arabia so they can continue their dictatorship there and so forth and so on.
Senator, do you pay your taxes so that another country can have F-35s? I don't.
Yeah.
It's just when you put it that way, you're like, wait, so my tax dollars are going to buy another country a tank,
Right.
when my kid's school looks like trash.
Look, all of which, gets back to where we are as a nation. And the truth is that in so many respects, this great nation that we love is failing ordinary people. So at a time, and you know all of this, Abdul, and I'm sure the people in Michigan know it as well, people on top, my friends, have never, ever had it so good. No, okay? You have more income and wealth inequality than we have ever had. So you got one guy, I mean, again, it's almost unbelievable to say this. You got one guy, Mr. Musk, owning more wealth than the bottom 52% of American households. Does anybody think that's what America is supposed to be about? So you got massive income and wealth inequality. You have massive amounts of concentration of ownership, where fewer and fewer large corporations, including in the healthcare industry, and we're seeing that every day. Small practices being gobbled up, right?
Either private equity or large systems.
Right. So fewer and fewer people have more and more control over our economy. And then what did these guys do with all their money? Well, they buy the political system. So it's not just that Mr. Musk spent $270 million to elect Donald Trump. I mean, that's pretty crazy. It's not, again, I mean, what can I say? The richest guy in the world says, all right, 270 million to him is pocket change, right? So let's do it. We'll elect Trump, good. And Trump has rewarded him. He's now much richer.
Well, it's a down payment, right?
It's a good investment. Very good investment. And it's paid off very well for him. So you got a corrupt, and it's not just the Republicans, as you will well see in your Democratic primaries. You got Democratic billionaires who put a whole lot of money into the Democratic Party and to their candidates. It's not only that, as we've discussed, we're the only major country not to guarantee health care at all. We're the only major country not to have paid family and medical leave. In America today, we have the highest rates of childhood poverty and senior poverty of almost any major country on earth. So getting back to the tax system and everything else, the priorities are totally backward in terms of the needs of working families, ordinary Americans. The system is designed to benefit the people on top. It is doing that phenomenally well. And our job, and your job, as a future United States Senator, to say, excuse me, that maybe in this country we need a government that represents all of the people, not just the top 1%.
Well, Senator, I really appreciate your support in this race. Grateful to everybody who joined us today, and I think that's a really great place to end it. And I just want to remind folks that right now it feels bleak, but often it's darkest before the dawn. We have an opportunity in the state of Michigan to get money out of politics, put money back in people's pockets, and pass Medicare for all. We're going to be fighting this campaign. We got a primary in August. We're going to be seeing a lot more of the good senator, hopefully in our state, leading up to that. But you have an opportunity to get involved. If this is a vision that you believe in, if you believe that we need fighters who are going to come to DC, not to make nice with the status quo, but who are going to show up and fight every day to get more people health care, to make sure that one good job is enough, to make sure that our politics are not corrupted by billionaire money, then I hope that you'll join us. You can go to abdulforsenate.com. Senator, greatly appreciate you making the time. This was an honor to, by the way, just so folks know, this is the dividing line. This was Vermont. This was Michigan, in case there were any questions here. Senator, thank you so much. I really appreciate you.
Great, Abdul. Thanks.